Okay, hi everyone. Ian Andrews joining you from LakewoodAlive. Thank you for being with us tonight for COVID-19, a Lakewood Community update. We really appreciate you spending some time with us. I'm joined by my colleague, Allison Urbanik. Allison is our Housing and Internal Operations Director. Allison will be helping us out tonight, fielding your questions. So as you think of something that you would like to ask our panelists, who we'll hear from here just momentarily, please type them into the thought bubble. We will take the questions throughout and then ask them at the end. So send them our way, and we'll be happy to ask our panelists at the end. So thank you, everyone. Okay, so we'll go through introduction, presentations, and then wrap it up with Q&A. We're joined tonight by Cuyahoga County Board of Health Commissioner Terry Allan. Terry, thanks for being here. If you'd like to say just a few words.
Sure. Thank you, Ian, and thank you, Mayor George and Dr. Hekman, joining you to be on this webinar. We look forward to talking to our residents in Lakewood. I've been with the department for over 30 years, worked in lots of different areas within public health, and I've been the health commissioner now for 16 years, and we're proud to be serving Lakewood and providing services since, I believe, 2007. So we're looking forward to the discussion.
Great. Thank you. We're also joined by Dr. James Heckman, Cleveland Clinic Lakewood Family Health Center Regional Medical Director. Dr. Heckman, if you wouldn't mind just saying a few words, please.
You bet, Ian. Thanks. It's really great to be here. Thank you to LakewoodAlive, and thank you to my fellow panelists, Terry Allan and Mayor George. Really excited about the opportunity to share a little bit about what we've been doing at the Cleveland Clinic. I am a practicing internist in Lakewood since 2016. I've been medical director for the Lakewood Family Health Center for the same amount of time, and just love this community.
Great, thank you, Dr. Heckman. Always a pleasure working with you. And we're also joined from the City of Lakewood, Mayor Meghan George. Mayor George, if you wouldn't mind just saying a few words, please.
Yeah, thank you, Ian, and thank you to you, Ian and Allison and everybody over at LakewoodAlive. Happy to join this distinguished panel with Dr. Heckman and Terry Allan, and looking forward to a good conversation to discuss COVID currently in our city, and what the Cuyahoga County Board of Health is doing, what the clinic is doing, and what we're doing here at the City of Lakewood to make sure that everyone stays safe through this pandemic.
Got it. Thank you, Mayor. We appreciate your leadership and support throughout quite a time. Also, pleased to be joined tonight by Interim Police Chief Leslie Wilkins. Chief Wilkins, if I believe we'll be able to unmute you if there's an opportunity that there's something you'd like to chime in on. So thank you for joining us tonight as well. And then we may eventually have Fire Chief Tim Dunphy on here as well. So thank you, and thank you for everything you do. So we're going to get started, friends. I'm going to move over, pardon the transition, and we're going to dive straight in. Let's begin with Terry Allan. Terry, I've got your presentation up on the screen, and we are good to go, so please take it away.
Very good. Thanks again, all, for taking your time this evening to join us. We'll go right to it so that we have time to get to the meat of the discussion. So if you could please take us to the next slide. Thank you. So today we'll talk a bit about data, and data that we track from the state, data that we collect here locally, data that we receive from CDC relative to trends and sense of the scope and magnitude of the outbreak. We'll talk a bit about what case investigation and contact tracing is, and what it means, and how it relates to our response in public health. We have a wide range of responsibilities that have expanded in the course of this pandemic, which is unprecedented. Certainly been 100 years since we've seen something of this scope in the United States and frankly the world. So we move on then to a range of state public health orders and guidance. We found that in the work that the leadership that Governor DeWine has provided, and certainly our hearts go out to him and his wife as they work through a challenge. We understand that Governor DeWine, we just all heard probably through the media that he tested positive for COVID. So we will be wishing the best to him and certainly to his family. But the orders that come from the state, we have responsibility to implement those orders. Often they fall to local health departments to implement. We've had a huge influx, 3 100 calls plus a day through our call center on a whole range of issues as different orders descend from the state, and then we have to read the guidance, and then often are charged to implement those orders at the local level. Lastly, we do a lot of community education, and we'll talk about that on a range of requests for us to provide public health guidance in a whole range of settings. So we'll get into that. Here you have a slide here that gives a sort of the snapshot from yesterday's dashboard. Many of you have probably seen this at the state level. So this is a dashboard that you can click on each county, and it gives you a sense of the current data. So you'll see as of yesterday, we had over 13,000 cases in Cuyahoga County alone. We also have had 2,169 hospitalizations, which is by far the highest in the state in any county, and 487 deaths and counting. We had just a few more, unfortunately, reported today. So this is not flu, folks. Last year, to give you a sense of things, we had a pretty heavy flu year. There were 50 deaths during the flu season of 6 months. We're 6 months into this, and we have almost 500 deaths, and we still have quite a ways to go. And we're looking flu season in the face, where COVID and flu will circulate together. So this is no ordinary time for us in this pandemic, and so it's been a real challenge. But we track these data and a few other components that we'll see next if you want to put those up. Next slide. There you go. So thank you. So we track. These are important indicators that we track to understand where the outbreak is headed in Cuyahoga County, and it's important for everybody to understand that the diseases don't know borders. They move freely across individual municipality borders. We find talking to people that are exposed and positive, they go to parties, bars, restaurants, funerals, weddings. They go to they go to vacation. They may come from childcare environments. We've had some sporting events associated with schools where we've had outbreaks. So they come from lots of different pathways, but people are moving widely across the county, multi-county, and the region, and certainly traveling on vacation to many places. So we look at the positivity rates, that is the percent of people that are positive that are tested from COVID. We saw a string where we went in 1 month from 3.7% positive to 9% positive, and saw our emergency department admissions, hospitalizations, ICU admissions rise very rapidly. And our case numbers triple between mid-June and mid-July, which has been very concerning to us. We're starting to see a bit of a drop, but we need to see a sustained drop for an extended period of time, for weeks, to have a sense that things are moving in the right direction. But the fall looms. We also look at the demographics of COVID cases. What we're finding now is almost 40% of our cases are between 20 and 40 in terms of the age range. So it's been trending younger. Our average age was in the 50s, and it's been over the summer, we've seen it start to trend younger folks moving widely. And so the concern is that, of course, they may tend to have milder illness, but they could interact with people that may be particularly susceptible. They may have chronic illnesses. We've had 35, 40-year-olds in the hospital in the intensive care unit. So this is nothing to mess with. The biggest concern we're thinking about these days going forward into the fall is thinking about testing capacity. So right now we test through the major hospital systems about 20 to 22,000 people a week in the three systems, plus there's additional testing that occurs in all the pharmacies, as you're familiar with, in CVS and Walgreens, Rite Aid, and the like. So what we don't have on our testing capacity that's concerning to us is the ability to test kids very much. Also, not to basically test people who don't have any symptoms. People are considered what we call asymptomatic. The capacity to test them is very limited, and so that's a challenge. So we're thinking about ways now with new testing methodologies that may be emerging, but they're still a ways off, about how we can increase capacity where possible. Next slide. So let's just talk a little bit about 4 key things that we do in tracking the pandemic. We do case investigation. So reports come to us from labs that are put into a state disease reporting system, and each county health department, city health department gets the reports, and then we then have an army of folks, usually on any given day up to 50 people involved with doing a case investigation. That's calling people, finding out their case history, when they became symptomatic, who they were in contact with, what their symptoms were, places they may have visited. We're finding too, it's important for everyone to understand that 2 days before you have symptoms, you can be infectious. You can spread COVID. That's the insidious nature of this. So you could be walking around not even realizing that you may have COVID, and for 2 days you could be what we call shedding or spreading that virus before your symptoms hit. And so then in those particular cases, if you are within 6 feet of someone for over 10 minutes or more as a general guide, you are considered a close contact. And so if you're a case, you need to isolate usually for 10 days, and then since your symptoms start, or 10 days from your test date, whichever issue is most relevant, and then 24 hours, additional 24 hours to be clear of, improved symptoms, basically having your symptoms improved. So you'd be isolated, stay home, stay put. Contact tracing is then the individuals that were in close contact with that case, they would be quarantined in the same manner for 2 weeks, because it can take up to 2 weeks for symptoms to show up from when you're exposed to when you may become infectious and show symptoms, and become then part of the whole process of transmission that we're seeing in the community. We also do lots of outbreak response. As I've mentioned, we've had outbreaks in long-term care facilities. We've had outbreaks associated with bars, restaurants, sporting events, people traveling to Florida, Texas, a whole range of outbreaks. We come together with often across borders. So we work with different health departments, track the outbreak, identify the contacts, and try to sort of cordon off and prevent widespread additional transmission in the community. And we also do lots of public reporting of our data up through the state health department. And some of that data is derived from the state, but some is derived from data that we populate through the Ohio Disease Reporting System on our case investigations and contacts. Next slide. And so lastly for us, we have responsibilities around state orders and guidance. And I'm here with Rick Novickas, who is our Director of Environmental Health, and he has served as a key point person here for the entire county on a range of these orders that come down from the state. Local health departments are responsible for implementing the orders from the state health department. And so we know that there is a statewide masking mandate that was signed by the governor. And so we have several ways to work through assuring we increase the use of masks. And why is that important? We know if you wear a mask, you protect me. And if I wear a mask, I protect you. And so we know that can significantly reduce the risk of transmission. Masks work. We have a situation where 2 people, hairstylists, were in Springfield, Missouri. CDC documented these hairstylists took care of 139 clients. Everybody was wearing a mask. So they were cutting hair right up against people for extended periods of time. The 2 workers were positive, COVID positive. Everybody had masks, the workers and the people that were getting their hair cut. Nobody got sick. Nobody got sick. We know on the Southern Hemisphere right now, flu is circulating down in places like Australia. Lower rates of flu at the moment. We're hopeful that it stays that way because they're having higher use of masks. So this is what this is about. We work with our county executive, who actually has helped us with our call volume by handling calls and concerns about where folks aren't wearing their masks. And the state has provided support from the Ohio Investigative Unit that will go to locations where folks are not complying. Now, we're not concerned about people that are doing their best to comply. These are places that are ignoring the law. And so we want to focus on those places that are sort of chronically not paying attention to the requirements. And by the way, we also appreciate the leadership of the City of Lakewood, Mayor George and Council for passing their mask mandate in Lakewood. We work with worker masking and social distancing. Worker masking is in place through the Dine Safe order from the state. And so distancing is important to make sure that people keep that 6-foot barrier to reduce risk, and making sure that workers mask as well. We also do a variety of consulting with a whole range of businesses, schools most recently, public buildings, to assess the sense of ways to reduce risk. People use physical barriers like plexiglass. We've seen that in grocery stores, for instance, to try to reduce risk in a whole range of places. If you can remote work, making sure that people stay home when they're sick, surface cleaning, hand washing, All these things can help to reduce the spread of COVID-19 and lots of other infectious diseases. And lastly, we do lots of plan and event review. There are a whole range of things that have happened, graduations, people wanting to have weddings or other sort of events, bringing people together and finding ways to do it within the scope of what the state allows, but to do it safely. And so Rick and his team do a hell of a job at trying to provide that support around events and planning to make sure that they're done safely. And so we have a lot of responsibilities at the local health department level. There's 113 health departments in the state of Ohio. And that's a general summary of what we do. And I appreciate your time here tonight. And we'll move on to I believe, Dr. Hekman. Thank you.
Great. Thank you very much, Mr. Allan. We're going to transition now quickly over to Dr. Jim Heckman. So Dr. Heckman, your slides are up on the screen. Microphone's yours. Go right ahead.
Okay, great. Can you hear me okay?
We can. You're all good.
Great, thanks. So thanks again for the opportunity to share a little bit about what our experience has been like here at the Cleveland Clinic. I hope to tell you a little bit about what the Cleveland Clinic as an enterprise has been up to during this wave of infection, as well as a little bit about what our local Lakewood Family Health Center has been able to accomplish. So our focus has been on caring for patients, caring for our caregivers, our community, and our organization. These are the Cleveland Clinic's 4 care priorities. There are some reasons of overlap in our approach with area public health entities, and there are some differences. Through the pandemic, our Northeast Ohio teams have worked closely with the Ohio Department of Public Health and the county public health agencies. One of our physicians, Bob Wiley, is heading the team of the zone of health systems and hospital preparedness. So I personally process information better with imagery, so I'd like to use the idea of a ship here today and a storm to help explain where we've been, where we are now, and where we think we're going to during this experience of COVID-19. Around March 13, we began to experience the first effects of the coming wave of coronavirus. Immediate steps were taken at the Cleveland Clinic in conjunction with state and local health departments and in step with the governor's orders to protect health and safety. Non-essential surgeries and face-to-face care were placed on hold. At the same time, telehealth and other electronic health technologies were rapidly developed to offer patient care from a distance. We changed our visitation policy at all of our facilities to minimize the number of people in our buildings and the number of people in the rooms at any given time. At that point, we were uncertain of how big the wave would be, and so surge planning was thoughtfully prioritized to accommodate the large number of sick people that we anticipated. And part of that was the conversion of the health education campus to Hope Hospital for the possibility of a very large number of sick individuals. It also involved retraining a number of our providers from ambulatory care and specialty fields to be able to provide inpatient care if called upon to do so. With an unknown quantity of PPE at that time, we developed conservation strategies for the PPE. And PPE is personal protective equipment. If you haven't heard already, it's gloves and masks of different varieties, gowns, things like that. We began to join existing or start new updates with leaders in our communities to keep them updated on rapidly changing pandemic information, which changed hourly, it felt like. Special supports were developed for frontline caregivers to help them when they became ill or when they were in higher risk situations. The Cleveland Clinic developed a home monitoring program to track any patient with COVID from any health system who tested positive at one of our testing sites. Next slide, please. So after the adoption of these important but somewhat severe interventions, we succeeded in keeping our health system from being overwhelmed. It allowed for the preservation of resources and I'm sure saved lives. But we in the medical community began to observe harms from a prolonged shutdown. Specific to us in healthcare delivery, we saw that patients were not being screened for cancer, and in many cases were not coming in for cancer treatment even. Our emergency departments and those nationally were seeing half of their volumes and patients were experiencing serious medical events at home because they feared seeking in-person care. Patients were increasingly impacted by delaying their needed surgeries, both in quantity and quality of life. We saw rising mental health needs, which was anticipated with the pandemic, but as they rose, the shutdown decreased our ability to meet those needs, including areas of mental health concerns such as domestic violence and gun violence. Beyond healthcare, the harms I'm sure have been experienced by a number of people listening to this call. The harms in businesses and services. Of course, we had the shutdown of the economy and heavy financial losses for individual businesses. There's greater unemployment, which leads to greater housing and food insecurity, led to a loss of health insurance for some. It led to an exacerbation of existing social and healthcare disparities, increased harm to the education and social development of young people. So from a healthcare perspective, we realized we needed to reopen our buildings again to allow non-COVID care to take place in order to right the ship and minimize the harm from a lockdown of many medical services. We developed some environment of care modifications, which allowed for infection risk mitigation in our hospitals, our surgery centers, our family health centers, and our medical office buildings. Businesses and industry similarly needed to reopen. As businesses remain closed, that was a tremendous hit to the economy. The unemployment surged, as I mentioned before. But unfortunately, as we reopened, businesses reopened, and in some cases, not following known preventive strategies. There were, as we've all seen, a rise in the number of cases. So to help our colleagues in business at the Cleveland Clinic, we developed webinars and a number of services to help companies reopen as safely as possible. At Lakewood Family Health Center, we answered questions from our community, including our library, our city government, local businesses, nonprofits, senior living facilities, and schools, and linked them to resources to help them develop safer operations. Next slide. So currently at Lakewood Family Health Center, we are open and we are ramping up our services. We're at 85% of the volumes we were seeing before COVID. We see that local businesses are also opening to varying degrees. We are looking at our current state and trying to anticipate the needs of the future. So a few specific areas of progress with increasing personal protective equipment supplies. We are moving toward a state of universal pandemic precautions, otherwise known as UPP, for all of our caregivers. When the HIV epidemic came through, there were universal precautions put in place for bloodborne pathogens. This meant that the underlying assumption was anyone who walked into your clinic could be infected with HIV or hepatitis. This is now in place for airborne pathogens, the thought being that anyone could possibly be harboring the virus. We will have all of our caregivers wear the ear loop masks and then wearing a protective face shield whenever they're in patient care areas or unable to achieve 6 feet of social distancing. We will continue to modify and the Cleveland Clinic will develop its surge capacity for potential waves of new infections while also providing non-COVID care. The way the system has designed the approach to this is we have a 5-hub hospital structure for COVID and cohorting of patients into COVID and non-COVID nursing units in our hospitals. We, in our buildings, will continue to practice environment of care modifications. This has included screening temperatures, a question checklist for patients and caregivers when they enter the building, social distancing in our clinical spaces and waiting rooms, infection prevention visitor policies, so limitations of visitors to those who absolutely need them, masking of patients almost universally. Of course, if it's medically difficult for someone to wear a mask, for a few exceptions, they will not be asked to wear the mask. We'll be doing regular cleaning and disinfection of the buildings, and then visual reminders of hygiene that is effective at preventing spread, and sanitation stations are spread throughout of our buildings. So we will continue to make a top priority the health and safety of our caregivers as well as patients. So as of last week, 10,550 total caregivers had been tested. More about testing. To date, the Cleveland Clinic has done 180,000 COVID tests on 6 different platforms. 2 of those are rapid tests where information can be readily available. There is a new method of testing which is under development, which will utilize saliva. We are presently monitoring antibody testing to determine when one could be used to identify past infection. As of this moment, to my knowledge, there is no antibody test that can be used to say something about any one person. There's no actionable information about a person, whether they have had the infection or they are immune based on antibody testing. At the clinic, when this started, we had the capacity to do 600 to 700 tests a day. Now that number is up to 2,600 tests a day, and it's anticipated by late fall we'll have the capacity for 5,000 tests daily, which will greatly increase the number of people who may be tested. We're excited to see that the Moderna mRNA vaccine has moved into phase 3 studies, as have many adenovirus vector vaccines globally. We now have a better understanding of that there are effective therapies, including the antiviral drug remdesivir, steroid use of dexamethasone, and convalescent plasma for those who become ill. We believe this storm will end, as all storms have in the history of the world, but until then, we'll continue these efforts.
Dr. Hekman, thank you very much. We appreciate that. We're going to transition now quickly to Mayor George. Mayor, are you there?
Yes, I'm here.
Okay, great. I have your slideshow up. So as you're ready for me to transition to the next slide, just please let me know when you'd like me to make that change. You are good to go. Go right ahead.
Sounds good. Thank you, Ian. Good evening, everybody. Thanks for joining us this evening on this important update. So, you know, it's no surprise that this is our priority within my administration. And we've been working tirelessly day in, day out to protect our community from this virus, from passing legislation to enacting programs to assist our community. So early on, one of the first things I did when the pandemic hit was assemble leadership from every department within the administration, because we were going to need to shift operations quickly to continue to meet the needs of our community, to deliver the services that everyone expects, but also keep ourselves safe, keep our staff safe as well. So we met daily. We probably only had 1 or 2 meetings in person before that shift to a completely virtual setting. And we met daily for weeks. We shifted down to a couple times a week, and right now we continue to meet weekly to get updates from every department to make sure we're staying on track. And again, we're addressing all the needs of the community. And we continue to provide services such as in human services. We have really shifted those services. We used to have seniors coming into the senior center. Now those services are being delivered virtually. Although it's not the same, we're trying to continue to provide those services. So for instance, we had not too long ago some senior bingo that was all online. We've had a few fresh food distributions throughout the community. So those are some of the things that we continue to do. In terms of legislation, we just on Monday passed legislation that would help our safety forces enforce the governor's health orders. So this is a mask wearing ordinance, which mirrors the governor's ordinance and health orders. And then we codified his health orders. So now that those are codified, we have the ability to nuisance the violators. So if you can hit the next slide, please, Ian. This enforcement tree is how those calls would come into City Hall if we get a complaint about a bar, a restaurant, some sort of business that isn't following the governor's orders. So the call would come into our dispatch center. Our police and fire department would respond. If there's no violation, there's the end of the action. If there is, a notice of violation is issued. We'd send copies of that to our law and building. And then if there's another violation, we would send a letter from our law department. And after a third violation, they would be declared a nuisance per Chapter 510. So that enables our first responders to enforce these health orders better. Prior to having this legislation, Cuyahoga County Board of Health, the Sheriff's Office, they were the ones doing the enforcement, and we all know how overburdened those departments are. So this is just helping our community. I would say that Lakewood is certainly leading the way in terms of this. This is the only legislation that I'm aware of in the state, and I participate in many, many mayors and managers phone call with mayors throughout the state. This is the only legislation I'm aware of that's like it. So we continue to look at ways to make sure that our community is safe through this pandemic. Next slide, please, Ian. And I wanted to talk a little bit about our small business community because it's just so important to Lakewood. It's really the fabric of who we are. It makes so much of our culture. So what we've done is we created the Small Business Rent Relief Program. Phase 1 was completed on May 5th. And we were able to help 118 small businesses receive a total of $187,000 worth in grant money to apply for rent. I'm happy to announce today, phase 2 was rolled out of the Small Business Rent Relief Program. And information for that can be found on our city website. But essentially, assistance of up to $7,000 per business can be used to cover rent and eligible payroll and expenses. So very excited about that rent relief program. Additionally, we released today the residential rent relief program. I'm very excited about this program as well, where we're going to be able to use CARES dollars to help those individuals who are having trouble paying their rent due to COVID-19. More information on that program can be found on the One Lakewood website or email our planning department. So again, we continue to explore ways to help our community through this once in a lifetime pandemic, and we'll continue to do that through the course of the pandemic. So with that, I want to keep my update short because I know we wanted to have some time for a few questions. So with that, I'm going to turn it back to the moderator, Ian.
Great, thank you, Mayor. Yes, we do have quite a few questions. So Allison, thank you for staying on top of that. I've seen them coming in. So go right ahead when you're ready, Allison.
Okay, so I'm going to try to keep these in order, and I apologize if I have to go out of order. But if we could just start, we've had some question about masks. So whether that's Dr. Hekman or Terry from the Board of Health, if we could talk a little bit about, I'm really sorry about my dog here, vented masks. Are they less effective than cloth masks? And I've read that they've been banned in California. Is that something that you think may happen here in the state of Ohio?
Allison, this is Terry Allan. Can you repeat the kind of mask again? I didn't hear what you said. Sorry.
Sure, absolutely. Vented masks. So the face masks that have the little vents on them on the cheek area.
So I'll jump in first, Allison. My understanding of some of the non-medical masks and the vented, I believe, is included in that, is that they filter the air coming in, but then going out, they don't do a very good job of filtering the air coming out. So there is and I'm not exactly sure if that's the type of mask you're referring to, but but I know with some of the industrial N95 type masks, breathing out, you don't have that filtration that you do breathing in. So that obviously is not good to those around you. Just a word about masks generally. It is very important that people wear masks. The more people that wear masks, the greater the chance that we have of getting this under control. If we look at the countries that wear masks, for instance, Taiwan, 23 million people, they've only had about 500 cases in that entire country. That was a combination of masking and contact tracing. The masking is key, but it also is not the only thing. You can't assume that because you're wearing a mask, that is your golden shield. It's not going to protect you exclusively. It's in combination with the rest of these things. So masking and keeping your social distancing at all times, despite wearing a mask, as well as avoiding a lot of touching of your face, making sure you wash your hands regularly. Masks are part of the solution, a very important one, but they're not the only answer.
And if I could add on to that, we did have some questions about face shields, probably very similar to what you discussed, but if you could talk a little bit about the effectiveness of face shields.
Sure. So the COVID virus is transmitted on droplets primarily. There is some question about airborne particles, which would be basically a droplet that's smaller than 5 microns. So a face shield is an additional layer of protection against those droplets that form when someone is talking loudly, when someone is sneezing or coughing. There's a potential for significant production of droplets. And the face shield is the first barrier to that, and it protects the potential droplets with virus from landing on the mask in the first place and leading to infection.
I would add a little bit to Dr. Heckman's comment, if I can, along that line. We found that in places, certain circumstances for some folks that they may be hearing impaired, they may have another challenge that prevents them from wearing a mask. They use a face shield. We've seen that happen in certain instances as a second choice. It's important to note that in the governor's order, the masking order, that there's actually a definition here that says, for the purposes of this order, facial covering or mask is any material covering an individual's nose, mouth, and chin. And so there are wraparound face shields that are more protective. They sort of wrap around the face, below the chin. And so we certainly think masks are the best choice. But in certain circumstances, it's certainly better to have a face shield than to not have any protection at all.
Great. Thank you very much. So now we're going to move on to testing. There are several different questions regarding testing. So I think we're going to start with actual testing right now, and then we'll move into how testing is counted and how that leads to statistics. We have several questions also about statistics. So with testing, what happens if someone is asymptomatic? So they don't know, they get tested. How likely are they to infect someone? So what is the infection rate of an asymptomatic person?
So that's a very good question. I can start off, and Dr. Heckman might want to offer some guidance there. So it's been estimated that 20 to 40% of folks may be asymptomatic. They can't transmit. To what degree they can transmit is very much an open question. Certainly, we think if somebody's fulminating and they're coughing and sneezing, they're more likely to project droplets, which is the usual pathway for exposure. That's sort of understandable to everyone. But if there is close contact with someone that is asymptomatic, they still are shedding, and they're positive, they still are shedding virus. So the risk there is certainly that someone appears to be fine, and then you're in close contact with them, and there doesn't seem to be much of a risk. So that's certainly a concern that we have out there. CDC has also said that perhaps 10% of all the cases are actually documented through a test and confirmed, laboratory or otherwise, so that there may be another, perhaps for every case there's there's another 9 people walking around out there that are that also are COVID positive. So it's important to recognize that we need to adopt, as Dr. Hekman said, this sort of universal precaution of using masks, social distancing, staying home when we're sick, remote work where we can, to limit the number of people in an establishment, hand washing, surface cleaning, all those things work combined with masks.
So I just have one thing to add to that. It is also the case that not only adults but children can carry the virus, and we know that the level in the nose of children is at least as high as in adults, and it's very likely higher in those young people under age 5. So they are definitely potential spreaders. We know they have fewer symptoms. They're less likely to have fever, less likely to have cough, less likely to have shortness of breath. And most cases are not severe, but they are, have the significant potential for spreading the virus.
The last piece is that there's a study too. I'd add to Dr. Heckman's information, a study, 65,000 people in South Korea, considered a very, very strong study that was recently released that basically also documented that kids aged 10 to 19 spread at least as well as adults do. So the risk for kids, we've heard people believe that it isn't there. We believe it certainly is. And we need to just remember that that all of us are potentially at risk.
So to follow up on that, are children being tested, and is there a difference between a test for an adult versus a child?
Well, so there are nasopharyngeal tests, there are nasal swab tests, there are sputum tests in development, and children are being tested, but they, in most of experiences that I've seen, that they are tested in when they're symptomatic and not routinely screening of asymptomatic children. As you can imagine, it's tougher to do the test on a child or young person. It's a bit an uncomfortable test. It's hard to have them stand still or sit still for the procedure. So I do know that that there are some other testing modalities being used, and they're, with an eye towards the fall, those are being developed in higher numbers.
Yeah, I would say to follow up with Dr. Heckman's comment, I think that we are our general sense from the talking to people in the community, and this actually speaks to some of our school recommendations, is concerns about the ability to test widely children. It does not exist, certainly not asymptomatic kids, and to a degree, not asymptomatic adults at the moment. We have high hopes that as we look to the fall, that there will be increased testing capacity. Right now, we have lots of availability of personal protective equipment, but the testing challenge is before us, and we need to, that's the next big mountain we have to climb in preparation for flu season.
So to follow up on that, Terry, so I think we all can agree that testing, there is a shortage of testing, right? So who is able to get a test right now? If you think you've been exposed, are you able to get a test? Where should you go? What's going on with testing right now?
I'll start off. Thank you, Alpha. I'll start off on the community side, and Dr. Hekman can talk about this health system side. So there are places where people are going right now. If you're symptomatic, we know that CVS, Rite Aid, Walgreens have drive-thrus. We see data and reports on cases from all those locations. That if people want to be tested and are having some challenge, they can go to those sites, and there are locations, actually quite a few locations, CVS around the county, and Walgreens, and as I said, Rite Aid. So I would consider those as options. We did receive some funds actually from the county executive working with Metro Health. We're doing some community testing in neighborhoods, under-resourced neighborhoods. So we're doing some community testing in locations where people wouldn't otherwise have access. And so those reports are available on our website, and they also get blasted out through social media. And those are locations where people can get tested for free, trying to serve folks that would otherwise not have an opportunity. Those are the locations right now, and Dr. Hekman certainly can elaborate on the system side.
So we have a couple of situations for testing. One is in symptomatic individuals. So symptomatic individuals who are also high risk. We feel as though the testing is best utilized for those who need it the most. And so those folks who have a symptom that is suggestive of from population studies, that symptoms that are suggestive of coronavirus, along with a high risk status. Citing the fact that I mentioned in my presentation that there is a harm to delaying routine care. There's a harm to delaying your colonoscopy, to delaying that hip replacement. We have initiated testing for individuals who will be going forward with considered non-essential surgeries, but we know they're very essential to the long-term health of someone. Having that test to make sure and then quarantining thereafter to make sure they go in and have that procedure in the safest way possible.
So Dr. Hekman, just to add on to that, anyone who's going in for non-essential surgeries is being tested before they go in for treatment?
There are there are a listing of procedures that have the testing and a listing that may not have testing, and that's carefully reviewed by a panel of experts on the likelihood that someone might spread coronavirus. So for instance, you may not be huffing and puffing for your echocardiogram, but if you had a stress test, you'd be more likely to do so. So all of those things are factored in when it's just decided if someone should have a test.
And again, just to add on, are you finding that, or what's Cleveland Clinic's way of communicating with patients to let them know about, all the safety precautions that are being taken, and, if they should get a procedure done now or if they should wait?
So I direct you to the clevelandclinic.org website. There are a number of modules there specific to coronavirus. There are instructions about care. There are webinars, information about reactivation of business spaces, information about reactivation of schools and safe restart of schools. So a wealth of resources are available on the clevelandclinic.org website.
Great. So now we're going to flip over to schools. What is maybe the Board of Health or Cleveland Clinic or even the City of Lakewood doing to support teachers and students when and if school, opens back up? Has there been any discussion amongst your entities how to protect students and teachers?
I'll start off, Allison. This is Terry. So we have been talking to schools since graduation and before. We have regular meetings with the Educational Services Center, which is really a facilitating body for schools, and now are meeting weekly, sometimes more often, with superintendents and other folks from the school community as they've been thinking about their plans relative to opening schools. We provided some guidance to schools that we believe, given the risks right now, that it's certainly safer to open remotely right now, to begin remotely, and also to suspend sporting activities while they are remote because of some risk for transmission based on outbreaks that we've seen to date. We know that they're recommendations. They are not mandates or board orders. And so we make recommendations, for instance, that schools or that individuals get flu shots. So our recommendations are for schools to use in their decision-making processes. And so we're finding a number of schools are going remote. Some schools have decided to go blended. Some schools have decided they want to have some sports activities. And so we've had a range of responses from schools based on what they feel they need to do in their district. So we've been working with them right along and will continue to do so. If there are outbreaks and environments relative to sports or school environments, we will be with them as well, working through that response.
And an update from the Cleveland Clinic, the Cleveland Clinic, the school-based healthcare team has formed a task force in collaboration with Pediatrics ID, the Ask a Nurse program, And they recently developed a webinar specific to the K-12 setting, which is part of the Wednesday COVID webinar series. There are also web sites, web resources being created, and we are actively reaching out to the school districts where we have a relationship to determine the ongoing questions they may have and tailor our response to their specific needs.
We've been just to follow up a bit, we've been working very closely with the superintendents and their staff. We knowing that no one knows, their buildings better than the schools. So if we did have cases in the schools, of course, they're going to have a better sense of where children or teachers may have been that are positive in their movement through the school. So it's very much a partnership for those that have school health programs as well. We'll be working closely with them.
Great, thank you. Okay, now we're moving on to Lakewood statistics. Terry, could you speak to what you're seeing in Lakewood in terms of folks who are being affected by coronavirus? What kind of, statistics you're seeing here in the community?
So it's as I begin, and actually Rick Novickas, who is our Director of Environmental Health, is doing me a favor and pulling up the data so I can have it handy. So the way we look at our data is we try to present it in a way, in a zip code map, in the way that we present our flu data, for instance. So I know that we're Lakewood is 417. What we do is we sort of color code our data and look at ranges because cases are in flux. We get reports of cases coming in every day. Lab confirmed or probable cases, those are people that were exposed to a case that were a contact and then they become symptomatic. They become a probable case and many of those are tested as well. But right now it's a color coded map and the range of Lakewood is right now 131 to 145. So in the sort of the 350 to 550 range. And the reason they're in ranges is because the numbers are constantly changing. We have several reasons why we look at this map that people need to understand when they look at this map. That oftentimes where long-term care facilities are, or where we have about 21% of our cases have been people working in healthcare environments. They could be nursing homes, a range of healthcare environments. Have represented 21% around of our historically our data on our cases. So those affect numbers. We also know that the size of a zip code often can speak to the the concentration of people that live in the zip code, but that people are getting exposed, as I mentioned earlier, all over the place. The map shows where the people live. So wherever you got exposed is not noted on the map, and it's on our website at ccbh.net, and you can go to the coronavirus page and see updates that we provided every week since almost the beginning of the outbreak with lots of data that may be interesting to you. But the map doesn't show exposure. It shows where the case lives. So the case gets reported by residents. And so know that any of us could live in Lakewood or Rocky River or Bedford, and we are reported as a case in that community, but we could have been exposed at work across town or another county or in Florida on vacation or at a wedding, in Akron. And so that's the challenge with this map is it isn't an indication of risk. So Lakewood has among those areas, it is certainly a larger community. And so you'd expect to see more cases per capita just because of size.
So to add on to that question, we did have a few people asking about folks who might be coming in from other counties getting surgeries done, maybe at Cleveland Clinic or other places. If they get tested, before they have their surgery or other things, or they're visiting and get sick, does that statistic go back to their home county or does it stay here in Cuyahoga County?
I'm not sure of the answer to that. I can find that, but I don't know.
So the answer would be, if I understand the question, if they live in, they live in Sandusky, but they come in they're tested here, I guess, right, is what you're saying. So they're tested either at a procedure at the Cleveland Clinic or at a CVS drive-through or something, and they live in Erie, they would be reported in Erie because
Okay.
that's where their residence is. But they could have been exposed,
Great.
you know, somewhere else.
Great, thank you. And then I have another question. If we could talk a little bit more about asymptomatic people. You had mentioned that it's hard to, I don't remember, I'm sorry, if it was Dr. Heckman or Terry Allan, that testing asymptomatic people may be difficult. Is that, did I hear that correctly, that actually getting a positive test from an asymptomatic person might be more difficult?
I'm not sure that was the message. We had mentioned that the ability to actually get tested if you're asymptomatic is a challenge because of some current limitations on testing capacity. And Dr. Heckman mentioned some efforts looking to the fall where there may be increase in testing capacity. I think that was the point. Dr. Heckman, anything you would add to that?
No, I think it should be, you know, just as easy to obtain from a, well, the viral load may not be as high, but it should be about the same to get from an asymptomatic person as someone who is symptomatic. That was not what I was saying. That there may be more testing options available going into the fall. Yeah, I agree with that, including testing for RSV and influenza simultaneously as well.
Great. So I have, I think, about 2 more questions, and one of that is related to influenza. Dr. Heckman, could you talk a little bit about what flu season is going to be like, you know, kind of adding into the mix, having COVID-19 around right now?
Yeah, so so we know that the flu is now, you know, it's their season in Australia, and from what we've seen already, that some of these pandemic precautions, so you know, all of the things that are being put in place are reducing the number of flu infections. So that's reason for hope and optimism as we move into this season. We will be developing, you know, a plan to do at the Cleveland Clinic. We'll be developing a plan to vaccinate our patients. It may look a little different than it has in years past, but we certainly recommend that everyone get that flu shot so you can at least rule out that as a make that less likely to be the thing that gets you sick in this upcoming season.
I would just ask that all of you take to the streets, that masks are the way through all this. Getting used to the use of masks and give you more freedom. That's the best way to describe it, particularly as we go into flu season.
Great. And then do you think that, is there any reason to not think that vaccinations will be easy to get for the flu? Is there any reason to worry about that?
I don't think so. CDC has said something like 180 million doses should be available. I think there's going to be a big push on flu vaccination for obvious reasons. If you have the flu, it may make you more at risk for other viruses like COVID and vice versa. I would expect that there'll be a big push for flu vaccination. Dr. Heckman, is that your sense?
Yeah, I think you know, that we are anticipating a big year for flu vaccine. I would also encourage people to consider getting a pneumonia vaccine if you haven't. If you are someone for whom it's indicated, including a diabetic, someone with immune system dysfunction, or someone over 65. And we know a lot of the complications of these infections come after someone is ill and they develop a super infection with another organism. So that would be very helpful to receive. We're not anticipating any problems with flu shot right now.
Great. Okay, I've got 3 final questions, Ian, and then we're going to wrap this up here. So this should be, I think, a relatively easy question, I hope. If you are someone who's in a high-risk category, so over the age of 60, and I'm sorry if that's not technically the high-risk category, but if you're over the age of 60, what are the symptoms that would kind of stand out to your healthcare provider to enable you to get a test?
I would say that the symptoms of coronavirus typically and most commonly are fever, cough, shortness of breath, headache, and this is publicly available information. Headache, muscle aches, loss of taste or smell, diarrhea. I think those are the big ones. So those symptoms most consistent with coronavirus would be those that would warrant testing. And we of course rely on the forthrightness and the honesty of those who present with those symptoms, that they in fact have them. It's very important.
Okay, and then what recommendations or advice would you give to someone who may have been exposed to coronavirus, whether it's a coworker or a friend or a family member? What is that person supposed to do?
So I'll start off with this one. So if they've been exposed to somebody who's positive, you're saying, so if they've been exposed to, let's say, a family member who they know is a lab confirmed positive, what will happen first of all is that it would be best probably for them, knowing if they're a family member, certainly most of the secondary cases, that is cases that are derived from being exposed to a COVID positive person, you're then considered a secondary case. Most of the secondary cases we see emerge are family members for obvious reasons. They're the ones that are in close contact with each other. And to that, I would just add that if you're at work all day and you're wearing a mask and social distancing and doing hand washing and surface cleaning, and then you go home and you're not wearing a mask and you're interacting with perhaps some young folks or others that are moving freely in the community, that's where that risk can be magnified. So there are lessons to be learned from being safe at work that you can take home as well. So what would happen then if you are a case and you're a person that comes in contact with a case, is it's likely that you're going to be getting a call then from the health department to determine whether you indeed had that close contact. And so if you're within 6 feet of someone for 10 minutes or more, that's considered a close contact, then you would be quarantined for 14 days. So that's how that process would work. And we basically make that determination. If you are exposed to someone who's positive and you know you've had close contact, you should quarantine. Best to be safe and stay home. You'll get a call at some point from a health department wherever you happen to live, and you'll be ahead of the game and you'll be part of the solution to prevent spread.
Great, thank you very much. And then our last question is for Mayor George. Mayor, if you could talk a little bit more about the process of working to keep everyone safe here in the city of Lakewood by enforcing the recommendations and the rules that have been set forth by the governor. What happens to a business if they are, not really following the rules and if they're declared a nuisance? Do they get charged with fines, or, what happens with a business?
Yeah, thanks, Allison. So we follow, again, the nuisance process in our code, so that that business would be fined, and the amount of the fine is based on the cost it was to the city to go out there and constantly visit that business. So the fine itself is variable, but no arrest or anything. It's a fine.
Great, thank you.
Okay, thank you, everyone. And gosh, Allison, thank you very much. Folks, if you could see, because I can see the question screen, we had a lot of great questions, a lot of long ones. Thank you very much for asking those, Allison. Thank you for synthesizing them and putting them to our panelists. If I may, just final thoughts from our friends on the panel. Health Commissioner Allan, any final things you'd like to leave us with?
I thank everybody for taking the time this evening to spend a little bit of it with us. Being safe is key. Help to be an ambassador of the use of masks, of staying home when you're sick, of surface cleaning and hand washing, and of getting your flu shot. And this is the way through this for all of us. And use of mask, again, is the way to personal freedom. It's the way to be able to continue to work and to keep the economy going. And so we'd encourage you to do those things and help us get through this unprecedented challenge. Thank you.
Thank you. Dr. Hekman, any final words you'd like to share?
Yeah, thanks, Ian. I would like to thank everyone for attending this. The fact that you are here today means that you are interested in this topic and you are the leader in your community. Would encourage people to role model the behavior they'd like to see in those around them. I agree and echo Commissioner Allan's suggestion about the masks. It's so important. We know that the virus spreads in crowded areas, crowded rooms, with prolonged exposure to unmasked people who are perhaps talking loudly. So in addition to all those things that are routine preventive health care to prepare for the flu season, as well as the hygiene and the masking that we discussed, consider the environment where you'll be going. It's so easy to be exposed in certain settings.
Thank you, Dr. Hekman. Mayor George, thank you as well for being here tonight, for your leadership in the community. Anything you'd like to leave us with?
Yeah, just wanted to thank everyone, thank the presenters, Dr. Heckman, Terry Allan, LakewoodAlive for putting this all together, and everyone that attended this evening. I hope you got a lot out of the presentation and learned a lot what all these different entities are doing to protect all of us and keep us safe. So really to close, let's be part of the solution. Continue to wear your mask, wash your hands, social distance. That's really the only way that we're going to get through this and get this virus under control. So let's all work together to get that done. So thank you again, everybody. I really enjoyed it this evening. If anyone has any follow-up, always feel free to reach out to me at mayor@lakewoodoh.net. Thanks.
Thank you, Mayor. And a great segue. We will send out a link to this presentation. It is being recorded and will be saved. And so that'll be ready to go tomorrow. So look for something in your inbox along with contact information and a couple of pieces of information. Thanks everyone for joining us tonight. Again, to my colleague Allison, thank you for helping us out. Our mission is to foster and sustain vibrant neighborhoods, and I think it's really important that we have these types of conversations. And that, being healthy is a pretty core component of having a vibrant community. So good health to you all. Thank you for being with us tonight. And please let us know if you have any additional questions. We'll be happy to pass them along to the presenters and stay tuned for future updates. Have a nice evening, everyone. Thank you.